today joining us is Aga Gelgie. Aga is originally from Ethiopia. He received his DMV from Gondar University in Ethiopia and later a Master of Veterinary Science from the University of Melbourne in Australia. In the spring of 2021, he joined the UT Department of Animal Science. He also served as a One Health Research Fellow in the One Health Regional Network for the Horn of Africa, or HORN as it's known, which is a collaborative One Health project between the University of Liverpool and Addis Ababa University. And I believe he's going to present to us today what he worked on during that time. But I will let him start sharing his screen and get started.
Thank you, Alisa, for the introduction, and thank you for the opportunity. And thank you, everyone, for your time and for showing up. I'm going to talk on our research on systematic review of rabies research in Ethiopia. So once I was back to Addis Ababa University, Ethiopia, from my master's study, while I was teaching, I was also having a role as a One Health Research Fellow in the HORN project. So this was the time we started thinking about how we can work on rabies as a HORN project. So we believed the best way to kickstart was to see where we stand as a country with rabies research. So we decided to start with systematic review, but finally ended up working only systematic review because I have to move to the US for my PhD program. So where does Ethiopia stand from the point of view of zero rabies days by 2030, which is the global strategic plan coined by Food and Agriculture Organization, OIE, or World Animal Health Organization, World Health Organization, and Global Alliance for Rabies Control. So these 4 organizations came together in 2015, and they coined this very ambitious global plan, which is zero rabies days by 2030. So where Ethiopia stands, and is Ethiopia on the course to achieve this goal by 2030? So we wanted to see what research is contributing for this ambitious plan. So we published our work in 2022. We are a group of researchers from UK and from Ethiopia. So we got it published in 2022. Let me start with rabies facts. According to World Health Organization, there are about 59,000 deaths each year globally due to rabies, due to human rabies. Human rabies is responsible for about $3.7 million loss globally. That's a lot of year of productivity, which is lost due to human rabies. 40% of the global human rabies case occurs in children under 15 years of age, which is mainly in Africa and Asia. Livestock days accounts for about 512 million USD each year, which is also mostly in the developing countries. Dog-mediated human rabies accounts for 99% of human rabies, which means domestic dogs are responsible for almost 99% of human rabies. Sorry. So when we started this research, we had a couple of research questions, which is what areas, geographic areas of Ethiopia are covered by rabies research. We wanted to know what is the knowledge saturation of rabies research in Ethiopia. The species focus of rabies research in Ethiopia, is it more human, is it more dogs or livestock, which is mostly studied? We also wanted to know what is the burden of rabies in different animal species and in human, and also what methodologies are used in rabies research in Ethiopia, which methodologies are mostly employed, where are the funding coming from, which country the funding is coming from, and also we wanted to know the extent of engagement of local researchers in rabies research in Ethiopia. We used preferred reporting items for systematic reviews and meta-analysis, which is abbreviated as PRISMA guidelines. So we first sat down and developed a protocol which contains the objective, what we want to achieve, and the inclusion and exclusion criteria of the publications and everything. And this is so helpful in a way that it brings all the reviewers on the same page. So we have the same inclusion and exclusion criteria. Basically, we're gonna have the same mentality on how to screening the publications. We use Zotero desktop software to import the publications, and Zotero helped us to convert those publications into RIS format so that it's easier to import those publications to Covidence. Covidence is the web-based systematic review management software, which was developed in Australia. So we used rabies and Ethiopia as a search term to search various electronic databases such as Web of Science, PubMed, WorldCat, Agricola or USDA National Agricultural Library, Scopus, Agris. We also considered thesis and dissertations, but from only few universities from Ethiopia. They are only Addis Ababa University and Jimma University. So we use rabies and Ethiopia as a search term to search through those electronic databases. After searching those databases, we imported references to Providence, like I said, and then we screened the publications based on the title and the abstract. Is it really focusing on rabies? Does it really fit our inclusion and exclusion criteria? But just based on title and abstract. And then we conducted thorough full text review of each publication. And then those publications which made to the full text review will end up in the data extraction. So we had data extraction template, which sort of guide us through all the publications to get those information that we needed. So the template contains all the questions like where was the study done? What is the geographic focus? What is the species focus? What is the methodology used? So we have that sort of template which help us to extract data from the publications. And we use Microsoft Excel for data analysis. So this is how it looks like in the Covidence for the title and abstract screening. So the studies pops up like in a stack of 25 or 50 or 100, depending on the reviewer's preference. So if we believe the study should be included, we hit yes. So if one reviewer hit yes and the other hit no, the publication ends up in the conflict, and the two reviewers can sit together and discuss about their conflict, and then say, okay, we're gonna say yes, okay, or we're gonna say no. So if both of the reviewers say no, the publication is not gonna be included. If both of the authors say yes, it's gonna be included, and it heads to the text review. This is the full text review. So it's pretty much like the title and abstract review, but in this case, it's thorough. So if one of the reviewer believes that it should be included, they hit included. And if the other reviewers exclude, and then it also ends up in the conflict category, and then they sit together and discuss and include or exclude. So it's pretty much handy, and it's really very helpful. I find Covidence helpful. And instead of doing systematic reviews manually, this makes sure that there's no bias. It makes sure that we got 3 authors at least. So that's the minimum for systematic review in Covidence. There must be 3 reviewers. If 2 of the reviewers do not agree, the 3rd reviewer is gonna step in and rule on the publication, but depending on discussion with the other reviewers. So it's very helpful and handy, and there is no bias. Almost there is no bias. This is the data extraction. This is a screenshot I took from the Covidence and data extraction. Looks like this. So 2 reviewers extract data. We're gonna have the full text on the left side, and then also we have the data extraction template on the right side. It's very handy. So we go through all those questions and see what that publication in particular is about. So there is also a 3rd reviewer who see the comparison and decide on the publication. So like I said, there cannot be any bias that way when we have 3 authors. So after data extraction, we had a total of 335 studies which were imported to Covidence. The beauty about Covidence, it automatically removed the duplicates. So it removed 155 duplicates. And then we were left with 180 studies based on title and abstract screening. We left out 15 irrelevant studies. And then we were left with 165 publications for full text review. And we excluded 46 publications because of no relevant primary data. And also we had 20 duplicates. Sometimes Covidence needs human supervision. Sometimes, just because of few letters differing, the same publication might end up in the full text review. So we removed 20 duplicates at the full text stage. We also focused on only English publications. So we removed 1 Italian publication. So finally, we ended up with 119 studies, which we did full data extraction for, and then exported into Microsoft Excel for analysis. So I'm gonna go ahead and talk about the results. These are number of studies or number of publications by regions. These are the percentage of studies out of the 119 studies. These are the regions in Ethiopia. We now have about 11 regions in Ethiopia, but we used to have only 9 regions and 2 administrative cities. And now we have 11 regions and 2 administrative cities. So Oromia received the most rabies research attention among the regional states, followed by Addis Ababa, which is the capital and which is also one of the chartered cities. The 2 administrative cities in Ethiopia are Addis Ababa and Dreddawa, and followed by Amhara, which is the northern region, and also followed by southern nations, nationalities, and peoples. Regional state. So surprisingly, there was no single study from Benishangul Gumuz, no single study from Gambela and Dreddawa. So that is the sort of regions that need to receive attention in the future when it comes to rabies research in Ethiopia. So geographically, those regions looks like this. This is Oromia, which is more of the central region of Ethiopia. This is Somali. This is the southern nations, nationalities, and peoples. This is Amhara. This is Afar, and this is Tigray. So most of the studies, rabies research, are focusing on Oromia, which is at the center of the country. Regarding the species, obviously human received the most attention, followed by dog and cat. Also, surprisingly, Ethiopian wolf, which is one of the endangered species in Ethiopia, received more attention compared to other species other than human and dog. We believe that was because of the conservation efforts that is revolving around these species. And these species normally live in the Bale Mountains, and there were a couple of rabies outbreak in this exotic canine species. That's why it's relatively receiving more attention compared to other non-human and non-canine species. So publications by method, the descriptive epidemiology is the most widely used methodology in rabies research in Ethiopia. This descriptive epidemiology includes studies such as prevalence, incidence, case reports, and outbreaks. So this is the most widely used method in Ethiopia as far as rabies research is concerned, followed by in vivo study, followed by ethnomedicine and knowledge, attitude, and practice survey. I wanted to draw attention to laboratory, since this is an infectious disease. Laboratory should be at least at where the descriptive epidemiology is now, because we can't really have a confirmatory diagnosis just based on those prevalence and incidence. So lab-based research need to be done in Ethiopia. So descriptive epidemiology should not be the most widely used methodology, because what people does most of the time is we decide whether it is rabies just based on the PEP administration or the post-exposure prophylaxis administration, or just based on dog bite. All dog bite cannot be rabies, because dogs might just be provoked and bite someone. So laboratory-based studies should be encouraged in Ethiopia instead of the descriptive epidemiology. The other figure we really worried about is the economics. So there is really minimal studies revolving around economics. That is worrying because we need to find out if there are different kinds of prevention measures which can be applied for rabies prevention. So those prevention measures should be economically feasible, and we can show that only by doing economics studies. And we can only convince the policymakers and the politicians by doing those research. As a vet or as human health professionals, yes, we know vaccination is the only way to prevent rabies, but the politicians and the policymakers might not be in a good position to understand that. So only study can show that. So those are the figures we are worried about. We only had about 7 studies that reported rabies incidence as per 100,000 population. So human rabies was more prevalent in Oromia, and dog rabies was more prevalent in Amhara based on those publications. And equine rabies is more reported in Amhara based on those publications. Authorship, authors from Ethiopia, entirely from Ethiopia, accounted for 46% of the 119 publications. About 40% of the publications were co-authored by authors from Ethiopia and from other countries. About 58% of the publications, first authors were from Ethiopia. About 29% of the publications had first authors from UK or from USA. About 51% of the publications had senior authors from Ethiopia. So this is kind of a worrying figure for us because other countries might provide the funding for us. We are grateful about that, thank you. But local researchers should be in charge of guiding those resources towards the national priority. So as you can see here, about 50% of the senior authors are from other countries, which worries us. Are those researchers really aware of the national priority when it comes to rabies research in Ethiopia? Source of funding, about 39% of the publications didn't outline or didn't state anything about source of the funding. About 29% of the publications were funded by organizations from Ethiopia. About 8% were partially funded by organizations from Ethiopia. About 62% of the publications were funded by other countries. And we are very much grateful about that. Surprisingly, about 12 publications out of 16 studies were funded for Ethiopian wolf. So is that really a country priority is our question. So like I stated before, about 99% of human rabies comes from dogs. So any prevention study, including the vaccination, should be focused on dogs. So this is a kind of worrying figure. So based on our findings, we concluded that there is significant gap in geographic coverage in rabies research in Ethiopia. So regions such as Benishangul Gumuz, Gambela, and Dredawa should receive attention in future rabies research. It's very surprising not to have even a single study from those regions. Studies were largely descriptive. So like I said earlier, descriptive studies might be good for some aspects of rabies research, but shouldn't be a dominant methodology to study rabies. There is a less investment in applied research in Ethiopia. It was very difficult to estimate national rabies burden because, as I mentioned earlier, most of the studies use dog bite or PEP administration as incidence measure, and that is not the right way to measure rabies. So rabies, there is only one national laboratory in Ethiopia until 2018, as far as I remember. So for a country that have about 120 million population, having only one national laboratory that deals with rabies case is very alarming figure. So it was difficult to estimate national rabies burden. The knowledge, attitude, and practice studies were very redundant. Most of them reported a very good knowledge, but very poor practice. But no study was followed by which practices are very poor, what they really mean by that, and what measures should be taken in the future to increase rabies awareness. So 119 studies for a country having about 120 million people is not adequate in our view. So there should be more rabies research in Ethiopia, given the impact of the disease on the ground. Therefore, we recommend there should be more resources allocated for applied research, for example, for door-to-door vaccination. Like I said, if we prevent rabies in dogs, so almost 100% we can prevent rabies in humans. Vaccine subsidies should be exercised, and there should be a research around that. There are countries which have done research around vaccine subsidies, and people are obviously more happier to vaccinate their dogs if there is subsidy. So, but this needs to be backed up by research and the cost-benefit analysis, which prevention method is feasible from cost point of view. That needs to be backed up by research. As a vet, I know that, but what do I gonna use to convince one policymaker? What do I gonna use to convince one politician who is in charge of the resource? So we need research. Laboratory capacity, as I mentioned, is very, very poor. There is only one national laboratory, which is in Addis Ababa. So what if there is a rabies case from south end of the country? What if there is a rabies outbreak from north end of the country? So laboratory capacity need to be built in Ethiopia. Rabies awareness, there are a quite fair number of people who still believe medicinal plants can cure rabies, and this is very fatal for someone suffering from dog bite. They're not gonna get any medical attention because of this people who practice medicinal plants. So rabies is a viral disease, so there is no way it can be cured by plants. So we need community awareness about this. As I mentioned on my first slide, children are the first victims, the first victims when it comes to rabies. So we need school education about rabies. school education about medicinal plants, school education about vaccination and all that. And we need applied research around those very important points. National rabies priorities should be set. Anyone who is coming from other countries who is interested in, let's say, they're interested in research around Ethiopian wolf, but we're thankful about that. Is that the national priority? Maybe not. So local researchers should be in charge of those resources, and national rabies priority should be set. With that, I'll wind up my presentation, and I would like to acknowledge One Health Regional Network for the Horn of Africa. I would like to acknowledge UK Research and Innovation. I would like to say thank you to Global Challenge Research Funds and the Saltsby Foundation. These are the really great organizations which support One Health research in the Horn of Africa, including Ethiopia, Kenya, Sudan, Somalia, and also, all the countries neighboring Ethiopia, which are in the Horn of Africa. They supported this research, but not only this research, all other research of One Health's concern in these countries. And I'm grateful to these organizations. Finally, this is the way I want to depict One Health. These are the musicians doing all their job, playing guitar, playing piano, and the melody that comes out of all these instruments brings such a joy. So that is pretty much One Health. Everybody, if we play our role, and the impact that comes from every person is gonna put an impact on human health, animal health, and also environmental health. So there is nobody who is exempt from One Health as far as we have the interest. So let's make sure we are contributing something for One Health. And thank you very much. With that, I will take questions.
All right, thank you very much. There is already one question in the chat from Janie. She says, in your opinion, is bat infection underreported?
Sorry, what was the question?
In your opinion, is bat infection underreported?
As I mentioned, about 99% of human rabies come from dogs. This is a figure which is confirmed by WHO. So that's why I think the wildlife aspect of the rabies, I think, is not well studied maybe. So do we have really those wildlife species who can be responsible for human rabies? That's also another question, but generally speaking, most of the human cases are from dogs.
Okay, and then I see that Michael has his hand up. If you want to unmute yourself, you can go ahead and ask a question.
Thank you, Dr. Aga, for the nice presentation. I just wanted to ask if you have any idea what could be causing the skewed geographical distribution of the studies that are on rabies in your country. Is it based on risk factors or population size, or even outbreaks that may be prompting such studies? Thank you.
So that could be one from the Ethiopian wolf, which mainly inhabit the Bale Mountains, is in Oromia. And Oromia is also maybe geographically favored to be at the center of the country. So maybe more resources are allocated in this region. Yeah, those are a couple of reasons I can think of. Did I answer your question? Oh, he can't hear me.
Oh, you got a thumbs up.
Okay.
Anyone else? Feel free to unmute yourself, or if you'd rather put your question in the chat, just go ahead. Do you have anything you'd like to end on, Dr. Gelgie?
Yeah. If anybody's interested to do a research in Ethiopia, yeah, I'm here to answer questions. I'm here to help with anything. Yeah, as far as I'm here, yeah. And if any question clicks up later, you can shoot me an email.
One more question, please.
Yeah.
Does Ethiopia have a One Health approach to rabies control, or any program or official strategy that has been adopted to control rabies in your country?
Yep. Recently, Ethiopia has developed a national plan that is gonna feed the 2030 zero rabies, which was also planned by those 4 organizations, and Ethiopia has recently developed that document, and I know there is one. I think it's called STEP. It's abbreviated as STEP, and Ethiopia. This STEP, what it does is it groups countries based on their efforts to eradicate rabies from their countries. So Ethiopia has moved from level 1 to level 2 recently because of them developing that document. So I know there are some national movements, like some vaccine campaigns going on recently. But yeah, there are some efforts going on in the country. Thank you.
All right. Well, if there aren't any more questions, I just want to thank you, Dr. Gelgie, for your time and for that presentation. It will be available later on our website if anyone wants to rewatch it or share it with a friend. And with that, I will say goodbye. Everyone, please have a safe and fun holiday weekend and enjoy your summers.
Thank you, everyone. Thank you, Elisa.
Bye. Thank you.
Bye.